Introducing the iCombat HAI's audit system from Kimberly-Clark Professional. After many months helping develop iCombat, the Children's Hospital at Westmead is looking to roll out the paperless system across its network. iCombat is invaluable to hospitals, given the considerable audit requirements of the NSQHS standards.
iCombat is really actually streamlining, standardising and making much more efficient our processes of auditing. The impost on staff of the audits required for the national standards has been huge. So we're actually really hoping to minimise that effect or that impost on staff by actually the use of iCombat. It can actually really be a tool that all staff can use because it's simple, streamlined, pretty standardised. It actually won't require us to do a lot of training with people to conduct audit. So if it's easy for staff to do, they get good information, useful information quickly, then we really increase the engagement of staff in the process. In terms of auditing, it just makes it so much easier, people using an iPad. So again, rather than the paper and the old Excel spreadsheet, someone's got to come and put the data back in.
iCombat collects real-time information in a consistent, centralised manner. Unlike paper-based audits, where it can take weeks or even months to collate data in a format people can interpret.
With thousands and thousands of moments of observations, that actually becomes very unwieldy very quickly. And so iCombat, the app for hand hygiene, is really a big improvement on that. It actually helps again streamline and standardise the data collection. So we can have really many more moments we can actually observe and look at our compliance without extra work.
It's not just about building up a body of information over time to see if there's improvement over time. We're also able to act immediately on any instances that we need to rectify there and then.
Before, auditing's always been very static, a real snapshot in time, and I think iCombat's going to really help us have quite an organic audit process where we kind of build on what we've done.
The hospital is harnessing the power of iCombat in its cleaning services division, particularly given NSQHS Standard 3.
And we've been working together with them as well to incorporate not just the cleaning audits, but also the task side of cleaning. iCombat is not only going to help us with auditing those jobs, but also they're going to help us to schedule the work that needs to be done, and to not only to schedule the planned work, but also to be able to manage the ad hoc work that is identified, particularly when you go around and do those audits and you see things that need to be rectified immediately. So we're very excited about that aspect of iCombat as well.
iCombat opens significant potential for collaboration between hospitals, for benchmarking and service improvement.
So with iCombat you can share forms, which means that we can both use the same form or audit tool and then collect similar data and then be able to do comparison. And as you know, one of the big things with improvement is to compare your data, because you might be collecting your own data for your own hospital and think you're doing okay, but it's not until you compare it with someone else that you can identify some opportunities for improvement.
The benefit, I suppose, of iCombat is that we're going to have good standardised data. We're going to have some assurance about the quality of it. We're probably going to have more of it because it's going to be easier to collect, and that data forms the basis of a lot of our improvement projects, which are about making things better for kids and families, and a lot of that information gets presented at the state level, national level and international level. So so that's exciting.